Hi, today let's talk about medical alert bracelets or color-coded wristbands as they're called in hospitals and facilities. Now, these are wristbands or bracelets that are worn on patients' wrists to communicate critical health information about the patient, which is very important, especially in emergencies. Now, there are bracelets that individuals wear, not necessarily in the hospital. They wear it everywhere they go. That has their unique medical information and their condition and their allergies and their medications written on those wristbands or bracelets. So the importance is that if they have an emergency, like for instance, if an epileptic patient goes into a seizure, maybe in the market or in the church or wherever, people are able to know that this person has this seizure condition. The information on the wristband will tell them this person has this condition, and this is then it to give them an idea of how they can help the patient. Paramedics will see it and know that, okay, look at what's happening to the patient. This is what we should do. So that is what those bracelets are for. So these bracelets can be color-coded, they can be plain, they can be fancy, but the most important thing is that they communicate unique medical information about the patient or the individual. So those bracelets are not what I'm talking about in this video. Excuse me. What I'm talking about in this video is the color-coded wristbands that inpatients wear in the hospitals. It also communicates critical health information about them, which is also very important for emergency. So with that wristband, any member of the health team that walks into the room, he looks at the wristband, no, this patient has this patient has that, and this is what I should do as a result of that. So that's what I'm talking about here. So like I said, they are color coded, and let me just go over all of them quickly. So this one right here is red. It says allergy here. So what this means is that that patient has a very important allergy, maybe bee venom or allergy to a particular medication, maybe penicillin, a particular antibiotic or whatever. So once you see this, you know that you are alerted that this patient has a very critical allergy that you should look out for. So you go back in the patient's information, check exactly what allergy this patient has, and then you plan accordingly. That is for that. Then this one right here is for risk. So when you see this one yellow, this one you see it so often, that means that the patient has the tendency to fall. Maybe the patient is not well oriented, or the patient has took medications that make them feel drowsy, or one thing or the other. Just know that the patient is at risk of falling. So that's what this one is for. Then this one right here is latex allergy. It's green. So with this one, you know that this patient is allergic to latex. You know the gloves that you use on the patient and some other consumables you use on the patient are made up of latex. So once you see this, what you should do is go and get the gloves that are not made from latex and those other consumables that you may be using for the patient that are not made of latex, and place them in the patient's room so that somebody does not come in with those other common gloves and then get the patient into a kind of anaphylactic reaction. Then there is this one right here. DNR. That is do not resuscitate. What it means, pink. It is not pink, sorry, purple. This is purple. So this one, it means do not resuscitate the patient. That's do not do chest compression. Do not try to, bring the patient back when the patient gets a cardiac arrest or anything like that. So that's what this one means. When you look at it, you know that this is what it means. Then, so before I move further, I would like to mention that these colors are standardized colors. That means everywhere you go, all the hospitals, they use the same color, you know, to communicate the same information. Now, there are some people, did I do this one? There should be one for limb alert. Let's see that one I dropped it. Oh, yeah, sorry. So there's one, this one is limb alert. That means that if it's on a patient's, maybe on the patient's right limb, that means it's alerting you to that limb. Maybe the limb has a fistula, you know, for dialysis. So you shouldn't take blood pressure there. You shouldn't poke the patient there. That's what it means for limb alarm or limb alert. Or some patients who have had a mastectomy that have issues with the lymph node in their axilla, they shouldn't get any pressure there. So don't take blood pressure, don't poke, don't mess with that arm. That's what it means when you see limb alert and this is pink. Now, some people may have 2 or 3 of these bracelets on their arm, you know, which is cumbersome. So somebody came up with the idea of this. Already, every inpatient has a bracelet with their name, medical number, their pertinent information on it. So on that bracelet, people came up with this idea of just clipping on these colors. This is for risk, this is DNR, this is limb alert. So this is what they do. They just get this. I mean, it's so hard to open. But what they do is, so let me use this one. They'll just take this and clip it on here like this. You see? So instead of this person now, if I were wearing this, that means I'm in 4 risk, limb alert, and DNR. So just in one wristband. So that is it. Now I want to point out that whatever information you see on these things, double check it on the patient's medical record, either on the computer or on the binder. Make sure it's the correct information, because some people may have this on their wrist, but they have changed their mind about this. They might want full resuscitation, and then you'll be going by this, and then the patient will have cardiac arrest, and you say, the patient has DNR, so I will not resuscitate, and that is a big problem. So check every information, double check it on the patient's electronic medical record or on the paper chart. Thanks for listening. Sorry this video is very long. Make sure to like, share, subscribe, and follow for more. See you in the next video.